Hi, everybody. Welcome to our Facebook Live Friday event. And our Facebook Friday events are where we have conversations with our healthcare partners. And the goal is to bring you topics that we feel are really relevant to our seniors, their families, and to our healthcare partners. Today's topic has gotten a lot of interest, understandably so. It's how to plan after a dementia diagnosis. With me are Danielle Dodson, who, so nice to see Danielle again. Haven't seen her for many months. Danielle is the clinical social worker and program coordinator at the wonderful Advocate Memory Center in Park Ridge. Also with us is Scott Tolan, and Scott is Open Arms, our own memory care program director. And Scott, we'll talk a little bit about both Scott and Danielle's backgrounds. Danielle has earned a master's in social work from the very prestigious George Warren Brown School of Social Work at Washington University in St. Louis, and it's with a concentration in gerontology. That's right, Danielle?
Right.
Okay. She is the clinical social worker and program director, as I said, for the Advocate Memory Center in Park Ridge. And the Advocate Memory Center does such good work with Dr. Gittleman and all your other associates, providing outpatient care, diagnosis, treatment, support, and clinical research trials for patients with Alzheimer's disease and other forms of dementia. So really important work. Great to have you as part of this conversation. And then Scott also has a master in communications and gerontology.
Correct.
And years of incredible work with seniors who have had some form of dementia. So great experience, and we're very excited that Scott's part of Open Arms team, and Scott will be focused on and is focused on developing our Embrace memory care program at home.
Correct.
So the last thing I just want to mention before I turn things over to Scott is just some really astounding statistics that every time I see these statistics, kind of take your breath away about Alzheimer's disease and just the impact it's having in our world. And these were pulled, thank you for pulling these for me, Scott, from
Sure.
the Alzheimer's Association page. And these are the latest statistics. Alzheimer's disease is the 6th leading cause of death in the United States. More than 5 million Americans are currently living with Alzheimer's disease. 1 in 3 seniors will die from Alzheimer's disease or other related dementias. It kills more than breast cancer and prostate cancer combined. In 2020, Alzheimer's and other related dementias cost this nation $305 billion. And by 2050, these costs could rise as much as $1.1 trillion. And then there's so many more statistics. I'll just leave you with this last one. And that is between 2000 and 2018, deaths from heart disease have decreased 7.8% through all the research funding and programs, while deaths from Alzheimer's disease have increased 146%. So it's just, it's just a statistic that takes your breath away. And that's why the work that we're all doing and the work, Danielle, you're doing at the Advocate Memory Center is just so critical. So I'm going to take it away. Scott, will you help moderate the questions and let's have a good conversation?
Absolutely. Thanks for that great introduction, Julie. And Danielle, thank you for spending your time today to talk about this important topic. What to do after receiving a diagnosis of dementia? I'd like to start out by just asking you, first of all, what are some of the warning signs that an individual should seek evaluation of a possible dementia?
Yeah. So first of all, I just want to say thank you to Julie and Scott and Open Arms Solutions for having me here to have this important conversation. I think, we're also caught up in COVID right now, and it's important that we not forget these, chronic conditions and the things people are living with every day.
Right.
So as far as kind of warning signs, I think the most critical point to keep in mind is that we're talking about a change from someone's baseline. So when we think about warning signs, we think about, most often people think about memory loss, forgetfulness, forgetting why they went in a room, or repeating themselves, repeating questions. Forgetfulness is one warning sign. But we're talking about diseases that affect the brain, and the brain controls essentially everything that we do. So symptoms or warning signs might go beyond forgetfulness, or for a person might not even include memory loss. They could be difficulty completing tasks that used to be familiar or easy for someone. Changes in judgment or decision-making abilities, visuospatial deficits where maybe someone's not seeing distances correctly, and so they're driving down the middle of the road instead of kind of straddling the line instead of staying to the right. Disorientation to time or to place, sometimes changes in personality. But again, the key is this is a change from baseline. So if you've always been horrible with calculations, and now you're having trouble calculating a tip, but you had that problem when you were 30, that's not too concerning. But if you've always been a mathematician or maybe an accountant, and now you can't balance your checkbook, then for you, that might be a warning sign.
Right. Okay. Very good. Where should a patient and family turn to seek some kind of an evaluation?
Mm-hmm. So, I think a good starting point is always to go to one's primary care physician. That person has your medical history. Hopefully you have a good trusting relationship with that person and that provider. And they know your baseline, right? So they hopefully would be able to detect if something is a change or just has always been maybe a relative weakness or quirk, if you will, of the patients. So I think the primary care physician is an excellent starting point. It's also kind of less threatening, if you will, for someone who's experiencing changes to go start with their primary care physician. In addition, Medicare includes now in the annual wellness visit a requirement that there be some mental status evaluation.
Right.
So it's a natural place to start with a primary care physician. But from there, it really does take a specialist and ideally a team to diagnose and care for someone with dementia. There are many, many causes of cognitive or memory changes. And you really need someone experienced and trained to tease those apart. So at the Advocate Memory Center, we work with an interdisciplinary team. We have a behavioral neurologist. We have a geriatrician coming on board soon, a geriatric nurse practitioner, a neuropsychologist. And so it's really a team approach in determining the cause of those symptoms and also providing really some holistic interventions and support.
Okay. If the person exhibiting symptoms is somehow resistant to an evaluation, how can they be encouraged to obtain one?
Yeah, so, and I think this is often a challenge. You know, we're often not the best judges of our own, you know, changes or weaknesses, and particularly when those changes are in the brain or when they're cognitive changes. Some patients or individuals are not able to see their own symptoms.
Right.
You know, it's kind of the nature of memory loss that if you've forgotten that you asked something, you might not realize that you're forgetting.
Right.
There's just no record of it there to draw
Sure.
on. And so it often is other people around the person with symptoms that notice. So I think, you know, again, by starting with a primary care physician, it can be kind of a non-threatening way to get an initial, the first step in that evaluation. I think also bearing in mind and making it clear to the person who has symptoms that, again, there are many, many causes of memory loss and other cognitive changes. And some of those causes are treatable. You know, we have had patients where they have polypharmacy. You know, they're taking so many medications, and those medications are interacting and making them confused, and making them, you know, excessively tired or distracted. And when they have someone really attuned to working with an older adult, you know, sort through those medications and discharge some of those medications, their thinking is really much clearer. So there are so many factors that could be contributing to these cognitive changes. And I think just kind of talking about that helps, again, to make an evaluation less threatening, to mention that, you know, some people, you know, are having a mood disturbance. They're feeling depressed, especially these days, right? When we're all isolated, we don't have the stimulation we usually have. We don't have the social connections. Depression can look like dementia. So having an evaluation to kind of tease apart, is there something here that's treatable? And if there isn't, you know, a cause other than a progressive dementia, you know, it's valuable to know so that we can put in place supportive interventions.
Okay.
Well, thank you, Danielle. You know what, Scott, I forgot to mention in the introduction, if anyone listening has a question, please feel free to submit it on the Facebook Live feed, and we'll do our best to take a look and answer your questions.
Okay. Right. Thank you, Julie. So Danielle, from what you said, I get the impression the evaluation can help sort out, what shall we say, reversible versus irreversible forms of dementia. Are there some other possible outcomes around that evaluation that are important to recognize?
Right. So that's exactly a great way to put it. There are some reversible causes of cognitive changes, and we want to pick up on those if they're there. You know, and then when we talk about dementia, that is an umbrella term for any condition that's causing a progressive decline in memory or other areas of thinking. So Alzheimer's disease is the most commonly known type of dementia, but it's just one type, and there are many other types of dementia that might present a little differently, that might benefit from different medications or different interventions. There are actually over 70 types of dementia. But furthermore, when someone is evaluated, They may be diagnosed with what's called mild cognitive impairment. So dementia really occurs on a spectrum. I think there's a lot of stigma and stereotypes in our society around Alzheimer's and other dementias, and we tend to picture someone who's in a severe stage of Alzheimer's or dementia. But when someone seeks evaluation early on, when they've just started to notice symptoms, they may be diagnosed with what's called mild cognitive impairment, where they have symptoms that are maybe noticeable to themselves or noticeable to others around them. Those symptoms might be detected on testing, but they're not interfering with that person's day-to-day functioning. And some people with mild cognitive impairment will progress into developing a progressive dementia, but not all. So that is one possible outcome of an evaluation.
Okay, very good. I think the next question becomes a bit of an ethical question. If a diagnosis is made, should the patient be informed of that diagnosis?
Yeah. So, I think this, there's been kind of a shift in understanding and thinking around this, the philosophy of disclosure of diagnosis. I have to say that, we as a healthcare field are not doing an excellent job in general on this. But, you think back to cancer and how a cancer diagnosis used to be kept from the patient in order to, I guess, protect them from that news. But we've come around as a culture, as a healthcare field, to recognizing the importance of disclosing a cancer diagnosis to a patient so that they can make care decisions, so that they can put in place advanced directives, so that they can maybe make changes in their lifestyle or make different decisions.
Sure.
And I think the same is true for individuals being diagnosed with Alzheimer's or dementia. They are full human beings, even if they're experiencing changes in their memory or thinking. They are still entitled to know what's going on with themselves and be informed of their diagnosis. They may or may not be able to fully understand or process that, but they should certainly be given that opportunity given the opportunity to make plans and talk about how they're feeling about that diagnosis or what they want for their future.
Okay.
Thanks, Danielle. Scott, we have a couple questions that have popped up, so let's see if we can
address those right now.
Yeah.
Sure, that sounds good. So the first question that came in, Danielle, is, are you seeing more earlier onsets of dementias in the younger population, specifically people in their 40s and 50s?
Yeah. So working in a specialty clinic, we certainly do see patients with younger onset dementia. I think those patients are cases that are often referred to a specialty clinic because a primary care physician or even a general neurologist might be less familiar with caring for patients with young onset. I don't know, to be honest, statistics as far as whether the prevalence of young onset dementia is increasing. It's still a very small minority of those with dementia. I believe 2% of those with Alzheimer's have a young onset diagnosis, but there are other causes of dementia that are more commonly seen at a younger age, such as a frontotemporal dementia.
Okay.
So we do at our clinic have patients, unfortunately, who are in their 40s, 50s, or early 60s. We consider it is kind of the accepted standard is diagnosis at age 65 or younger is considered younger onset.
Right. Okay. We do have another question, Danielle. I'll go ahead and address that with you now. So the viewer asks, what is the best way to refer a family to Danielle and your clinic, the advocate program?
Thank you for asking that.
Sure.
Yeah, so we, our clinic is accepting new patients. The Advocate Memory Center, our primary site is based in Park Ridge at Lutheran General Hospital. We're an outpatient clinic there in the Parkside Center, and patients or families can call our main number, our front desk, which is 847-720-6464. We do request a referral from the primary care physician and some notes before an evaluation by our neurologist or our nurse practitioner, so that we're not kind of duplicating services and we know what's already been evaluated. I personally, as far as the support, the counseling, care planning assistance that I provide, my services are primarily devoted to those patients of our clinic. So those who have already seen our neurologist or our nurse practitioner or our soon to be onboarded geriatrician.
Very good. One more question came through. Do you see patients with memory issues relating to TBI or traumatic brain injuries?
So yes and no. It's kind of a complicated question. We generally, if patients have had, a recent traumatic brain injury, they might be evaluated elsewhere for the effects of that brain injury, but we do see patients where they've maybe had repeated concussions, the condition that maybe in the past couple of years had some press, that chronic traumatic encephalopathy that some was detected in some NFL players. We do see patients who've had those concussions earlier in life and now are developing some symptoms of memory changes or personality changes. And the primary care physician or family, is looking for some help kind of teasing apart what the causes are.
Very good. Well, we're getting a lot of questions here, which is great. The next one comes in and is a question about really your current situation, I think. Are you seeing patients in person right now, or are you using video conferencing?
Yeah. So I will say we primarily had transitioned to doing telehealth, seeing patients by video using Zoom technology, a secure Zoom platform that's password protected, or via phone when Zoom wasn't available or accessible for the patient and family. We are on a case-by-case basis. Our neurologist and nurse practitioner are seeing some patients in person if it's really critical for the evaluation. So if someone has declined rapidly, if they're having maybe some movement disorder or changes in their movement symptoms or repeated falls, those are things that that our providers might determine need to be evaluated in person. And Advocate has, we were talking a little about this before, a safe care promise that we are taking extensive measures to ensure the safety of our patients and their families when they do need to come in and be seen in the clinic.
Okay. We have another interesting current state kind of question as well. Do you expect to see a more rapid decline in individuals with dementia due to the isolation from COVID?
Such a good question. I can say, I think the situation is obviously changing day to day and week to week. I don't know that there's been research or statistics out there on this yet, but I will say anecdotally, from the families I've spoken with, and I've been on the phone quite a bit these days with
Sure.
families, that families have been noticing more decline. For some patients, that's manifesting in kind of agitation or anxiety.
Right.
I think we all can relate to that, right? Feeling
Absolutely.
maybe a little
Absolutely.
cooped up, feeling some cabin fever, or some anxiety about what's going on in our world, or some depression about being
Yeah.
isolated. So we are seeing some more agitation in some patients. Some families do, describe some more disorientation, which again, I think we all can relate to, not knowing what the date or even the month is perhaps at times these days. So yes, we have seen some decline because of the isolation.
All right. I'd like to go ahead and ask one last question, Danielle, and then we will stay on, I think, a little bit longer just to entertain any additional questions that we might get. So my last question for you is, what are some ways that diagnosed individuals can feel a sense of hope or empowerment? I think it's good for us to end on that note.
Yeah. Thank you for that question, because I think, as Julie was sharing those statistics, we often think of Alzheimer's, and we think about these frightening statistics and sad realities, and again, those stigmas and stereotypes that we see, and certainly, not to minimize the pain and heartbreak that these diagnoses can bring. But there is life after a diagnosis of Alzheimer's or another dementia. I have seen patients find hope in participating in clinical research trials, which we do have at the Advocate Memory Center. I'm feeling that maybe they're taking a clinical, a drug that's being tested, maybe it'll help them. And if not, they're contributing to the future of science and of understanding of the field. I've seen patients find a sense of empowerment in connecting with others who are diagnosed, particularly those patients who do have awareness of their condition and insight into it, just talking with others and realizing that they're not alone. By participating in a memory cafe or an early stage support group or an online platform, I think that can give people a sense of hope as well. And then I would say again, having the opportunity to have conversations about what the patient wants for their future.
Right.
Documenting those things in a power of attorney and advance directives, having, self-reflecting on kind of what their wishes are for how they want care to look when they need that care in the future, I think can be very empowering and give people a sense of control over a situation where a lot of control is taken from them.
Yeah.
Okay.
Well, thank you so much. I think
Yes.
we are running short on time, and what I would just say to everyone, because this is, I'm imagining that there's some questions that you may think of after this session. I want to make sure that you can know that you can reach out to. I'm going to give you Scott, your email address, Scott.Tolan, TOLAN at openarmssolutions.com.
Right.
Danielle, would you be okay? I'm kind of putting you on the spot, but to give out your email address to.
What I'd say, we try to, just in the interest of confidentiality, email is maybe not the most secure form of communications. I'd be happy to take questions kind of that Scott might funnel to me. I
Great.
might also encourage people to visit advocatehealth.com/memory center. A lot of questions are answered there. And again, our clinic can be called as well.
Sounds great.
I want to just close by thanking you so much, Danielle.
Yes.
Just the little bit of time we've had together, I know we've answered some questions for people that were pressing, and the information you gave was terrific. Scott, thank you so much for moderating.
You're welcome.
And look forward to seeing everybody back. Our next Facebook Live is next Friday.
Correct.
We're going to be talking with Charlotte Bishop, and Charlotte is a geriatric care manager.
Right.
And talking about different topics related to our aging population as well.
Right.
So thank you, everybody. Thanks again, Danielle. Great to see you.
Thank you. Thank you so much for having me.
Absolutely.
Take care.
Bye-bye now.
Bye-bye.
So long.